When Mother's Day means celebrating your mom, your wife, maybe even your daughter as a new mom, trust 1-800-Flowers to help you celebrate every important woman in your life. With double blooms from 1-800-Flowers, order 1 dozen roses and get another dozen for free. It's a simple way to give beautifully, with colorful blooms that make Mother's Day feel meaningful. For every mom you're celebrating, order with confidence and get double blooms at 1-800-Flowers.com/podcast. That's 1-800-Flowers.com/podcast.
Hey there, and welcome to the Think Fitness Life podcast. We're fueled by the incredible clients who inspire us every day, allowing us to elevate their health and fitness journeys. On this show, you'll gain valuable insights from top professionals, hear inspiring transformation stories, and discover the knowledge and motivation to create your own best life. Let's dive in. As someone who has continuously used therapy as a way to heal and elevate my personal performance, I know wholeheartedly that you cannot always read the label when you're in the jar. And that's why it's so helpful to have a professional in your corner to talk to. This podcast is sponsored by BetterHelp to provide our listeners with the opportunity to work with a licensed therapist from the comfort of your own home. Receive 10% off your first month when you sign up by going to betterhelp.com/TFL. That's betterhelp.com/T as in think, F as in fitness, L as in life. And remember, you're not alone. There are people out there who can help.
All right, welcome back to the Think Fitness Life podcast. We bring in a lot of various professionals on this show to dive into the world of health, of nutrition, medicine, mindset. But one thing in my career that I've always really found that it circles back to, and throughout my years of diving into the research and trying to understand how the human body works, is it really comes back to our neurology and our brain. Our brain is one of the most well-designed, powerful tools on this planet, but yet it's unknown and it's misunderstood. Many people have a hard time understanding how the brain actually functions. They know it can create motor patterns, speech, and thought and process and control many systems, but there's way more to it. And a lot of people get confused when they start talking about mindset and they're talking about pain and injury and how it can become developed from neurology and their past history and how we've developed as humans. Because every human is different as they develop. Every human has a different development growth track, different life they've lived. Their neurology can be different than someone else's. And that world, it scares a lot of people. But today, we get to dive into that world. We have someone who understands neuroplastic symptoms, who dives in treatment of neuroplastic symptoms and made his career about that. Dr. David Clarke, welcome to the show.
Great to be with you. I can't wait to share these ideas with your audience.
Kind of before we get started, what really drove your passion to get into this field and eventually end up in you're treating neuroplastic symptoms, which we will get into because I assume most people have no idea what neuroplastic symptoms are, but they're going to learn today.
Hey, I had no idea either the first 7 years of my training, if you can believe that. But it's absolutely true. The assumption is that if you've got pain or illness, it must be due to an organ disease or structural damage. But it turns out there's this whole other category of the brain, which, as you described, is extremely powerful. And it's fully capable of causing absolutely real pain or illness pretty much anywhere in the body from head to toe, from migraines to fibromyalgia to back pain to muscle injuries to certain kinds of rashes, bladder, bowel, pelvic, genital symptoms, chronic fatigue. The list just goes on and on. And I had no idea that this was even possible through the first 7 years of my training. And then in year number 8, when I was still training, I encountered a patient I didn't know the first thing about diagnosing or treating, and she had one of these conditions. She actually was averaging 1 bowel movement per month, despite taking 4 different laxatives at double the recommended doses. And We couldn't find anything wrong with her. She'd come from another university where they couldn't find anything wrong with her. And I was doing her exit interview and essentially telling her she was going to have to live with this. But the conversation kept going a little while, and she finally trusted me enough to tell me that she'd been abused as a girl by her dad. And I'd never heard that from a patient before. I didn't know it was something that I should even be looking for, but I connected her with a psychiatrist at UCLA where I was in training who knew about these connections, and she cured this patient in less than 3 months. And when I found out about that, I was shocked. And I thought, okay, if I'm going to be a complete doctor, I should know how to do this. And she gave me her basic framework. And I thought a couple patients a year, it might come in handy. Well, my normal practice when I got into Portland, Oregon to start my career was to do the diagnostic tests on people. And if I didn't find an organ disease or structural damage to explain somebody's symptoms, I would use the framework that Dr. Kaplan had taught me. And I was finding 5 or 6 patients a week with these brain to body conditions, some of which were bad enough to put a person in the hospital. But I was able to help them. They were getting better. The rest of the healthcare system was not helping them. And it just became a normal part of my practice, about 1 out of 3 of my patients. And I've been doing it ever since, over 7,000 patients since the 1980s.
And when you think 1 out of 3, I would assume for you that's like, oh, I can help treat people better, because that's what a lot of us coaches and doctors look for, is like, how can we improve our treatment and help people actually get better? And that's one thing that I've realized over my career as being a coach, is that the mental aspect, the neurology, plays a bigger role than anything possible. And it's fascinating, even if it's like your individual, like that's a traumatic history. It doesn't it doesn't have to be that traumatic.
That's right.
But, and I'm sure we'll get into it, but it creates a lasting impact in your brain from a memory standpoint. And then that elicits other things. And it's, when you read literature, you read books, it's like, these are little checkpoints and things come up and it's going to reignite that checkpoint. For you, how was it when you kind of had that aha moment, like the brain, where did you go from there?
Well, it gradually evolved into a well-defined process of evaluating people with these conditions. And when I had somebody that had a physical symptom like abdominal pain, or later in my career, it got to be some of these other things like migraines and neurologic problems and sometimes visual disturbances. One gentleman had total body itching of his skin, but I would use the same process for all of them. First of all, what stress is going on in your life right now? And can I find out any connections between the stress that's in your life right now and when and where your physical symptoms started and what's been their pattern, their fluctuations over time? One gentleman, very simple, but none of his other doctors had found this out. He only got his symptom when he was driving to work. When he was driving home from work, he was fine. Same on the weekends. When he was not at work, he was fine. And the natural next question was, what's going on the job? And there was a huge stress there that had been going on for exactly the same time as his symptoms had been going on. This empowered him to go back to his supervisor, make some changes, and lower the stress level, and physical symptoms went away from that. Other people, it's more complicated, like that first patient. Pretty much anything that you went through as a kid that you would never want for your own child or for another child that you care about. It doesn't have to be something as traumatic as abuse. It can be just not getting the love and support that every child deserves from their parents. Or another patient of mine was, her parents meant well, but what they did was they wanted their daughter to not feel her negative emotions. If their daughter was feeling anger or shame or grief or guilt or fear, they would try to get her to put those emotions away somewhere. And if she didn't, they would send her to her room until she succeeded in burying those emotions somewhere. But we need those negative emotions as a signal to us when something in our life is not going well. And if we don't have that signal, we're liable to make all kinds of bad choices. And that's exactly what happened to her as an adult. She chose her career poorly and inappropriately. She chose a lot of close personal relationships poorly and inappropriately. And this all contributed to a building stress level that led to her having lots of physical symptoms for a period of 16 years. I'm looking for all of those things: stress in the present day, stress in the past. And when I find them, we can almost always do something about it and people start to get better, sometimes pretty quickly.
In the past, when people have something that goes on in the past, like that individual, and they start making decisions in current day based off of what they've learned, do you I'm sure you also feel, do you feel it's a neurotransmitter issue? Like, because they've suppressed emotions much or certain things, that they're looking for certain dopaminergic or serotonergic fixes in life, they end up choosing things, or it could be more compulsive activity, like, oh, I need this now, whatnot.
Yeah, all of those things are possible. What I see most often are that in order to survive a childhood experience, people develop certain personality traits that helped them as a kid, but that are causing stress for them as an adult. And this can be just trying to be the best person you can be, but doing it at an extreme level to where you're a perfectionist, and no matter how well you do something, it's not good enough, or you're feeling like you're an imposter. If you're given a promotion, you feel like you don't deserve it. You can be very self-critical. You can be the kind of person that is taking care of everybody else in your world, but you're never putting yourself on the list of people you take care of. And sooner or later, that catches up with you and the body starts to protest. Difficulty asserting yourself, difficulty feeling your emotions, having really powerful emotions that you're not even consciously aware of can be a big part of this. Having triggers in your life. Many of my patients, they had an abusive parent, or a parent who neglected them, or a parent who wasn't emotionally supportive. And that parent is still in their life as an adult, still creating stress for them. And they never learned how to set boundaries around that when they were kids, of course. And they still don't know how as adults. And there's a source of stress there. And then the other aspect of this that you mentioned is about what do people do to cope with all of this.
Mhm.
And sometimes they definitely look for what we might call dopamine experiences. They may be people who take risks. They may be people who have addictions of one sort or another, not necessarily to substances, but it can be behavioral addictions like gambling or sex or work or food or video games, all kinds of things, pornography, anything that any kind of addiction can be a form of self-treatment. Even cutting behavior can be a way to where people cut themselves. Why do they do that? Well, in my patients, they do it because they've buried their emotions completely, that they're not feeling much of anything at all. And when they cut themselves, they're at least feeling something. But yeah, it can manifest itself in lots of different behaviors in addition to the physical symptoms. I should mention also eating disorders is another one, especially among women, but sometimes among men as well, that they have bulimia or anorexia. And it's a way to exert control over their bodies and control over their food intake at a time when they may be in a state of emotional chaos from usually from past adversity as kids. And when they're controlling their bodies in this way, again, it gives them some little form of relief.
It's very interesting that the human body, now these people probably don't know that they're trying to self-treat themselves, but the brain is trying to self-treat or avoid certain things. And the hard part for many people that aren't in this field is they don't understand that, or they don't see that. They just go, why do I feel like this, or why am I like this? Not understanding that past trauma or neurological trauma can drive all the stuff you just said. And they're kind of going down this road of like, oh, what is causing this now? Why do I feel like this? But you're now on peeling back the layers to help someone understand, like, they had no control over what happened to them, depending on their situation when they were younger. And those are prime periods in life where humans need safety, security, nurturing, and naturing, and they don't get that, and it sets them up for things down the road. But you can treat it as you get older, or you can make it feel better, especially when it comes to, I always find it crazy when you start getting pain that's associated with those traumas that will come up through whether it's body tone, body tension, tightness, reaction, or just generally your brain's putting pain in an area to manage some sort of signal that the neurological system is putting out.
Yeah, absolutely. It's almost any symptom that physicians are having trouble explaining, almost any condition that is not improving as a physician expects it to, or a physical therapist is feeling like this person should be getting better with the treatment measures that I'm using here, or if you're a coach or trainer and this injury problem is going on for a lot longer than you expect it to, it may be that there's a neuroplastic reason behind it. You can also see people who are almost addicted to exercise from this cause, that people are just driven to focus on their bodies and on their fitness to an extreme degree. And it can be driven by this same idea that if I can be perfect, if I can be the best person possible and just nonstop pursue my fitness goals, that also can be driven from an unhealthy place. And it's good for trainers and coaches and physical therapists too to be aware of that. I should add that for people that are curious about whether their own personal symptoms might be connected to any of this, we've got a self-assessment quiz, only 12 questions on symptomatic.me, takes less than 3 minutes and gives a lot of information about this that can apply to an individual.
Then people can kind of go there and they can do the self-assessment and then see where they can go after that, or what.
There's a lot of resources there. If you the quiz is set up that the more questions to which you answer yes, the more likely it is that there's a neuroplastic contribution to your pain or illness. And if you get a lot of yes answers, then there's a bunch of resources on there. There's videos, courses, recorded conferences. I've got my own podcast where I interview patients, much as I used to do in my office. Lots of things that people can take advantage of, including science-based apps and books that we recommend.
That's awesome. I mean, it is a hard thing for people to understand neurology. I mean, you look at some of these neurology textbooks, you've read probably a bunch more than I have, and they're like hundreds of pages, small print, and they're just going into cellular talk and pathway talk. And it is very confusing to have something that can help people understand maybe their own neurology or how things can stem up from a past injury or past trauma. It goes a long way. And especially where I'm working with a lot of athletes, you kind of see that from more or less from when they get like injured. Someone will tear their ACL, that changes their whole kind of getting back to play, getting back to life, more mental mindset, maybe more acute than long term. But I don't see them years later, but you never know what it can stem from down the road, or because of what happened and how someone feels about it. It's always important to take in consideration someone's mindset and neurology when you're treating someone.
Yeah, absolutely. A torn Achilles tendon is a good example of something that is not neuroplastic because it's a real physical damage that's going on there. But what can happen is that after a physical injury heals, which is fairly well defined depending on the injury, how long it should take to get back to normal. But there are some people, a certain fraction of people after an injury, where the condition persists long after it should have healed and the person's function should have gone back to normal. And when that happens, that's a good time to begin exploring for these issues. One other idea that I should have mentioned earlier is that many of my patients are busy taking care of everybody else in their world that they just don't take time for their own enjoyment. They don't put themselves on the list of people they take care of. You ask them, what do you do for fun? What do you do for your own joy? And they have trouble coming up with things. Some of them will tell me it's actually the gym, which it's definitely a happy space for a lot of people, but it is goal oriented for many of my patients that it ends up not quite being what people need, which is essentially the moral equivalent of finger paints for a 4-year-old. We all need something that's just for fun. It doesn't have any goal to it. It's just for us to relax and get away from our usual world. I used to play soccer up until age 60. I played on up to three teams at a time, and I just loved it. I mean, it took me completely out of my normal world. I was with a bunch of guys that we'd go out for a beer afterwards. We'd talk about everything except our work, and it just took my own stress level wherever it was and brought it way down.
I like that because you're referencing something that like you're not striving for, and a lot of people have this driven being of like, hey, I have to be the best at this, or I have to do this, and it's always a competition. And when I hear you say that, it's like I reflect like a lot of that's what I am is like very competitive, always played sports and understand, but then there's just time where you can have fun, and it doesn't have to be, oh, I have to be the best there is. And you never really look at that. You're always like, okay, here's the next task that I have to accomplish. Here's what I have to do. And I'll go look back and think of things like, okay, that's what I like to do for fun. And I can just kind of shut off and not have to worry about like, hey, this has to get done. And more people taking that to their advantage will also take them into a realm of kind of easement, right? Their autonomics are going to come down. They're not going to be sympathetically driven, which we see now in this world, like sympathetics is taking over.
Yeah, that is definitely happening. And I was definitely trying to be the best that I could possibly be in the workplace. But it was great to get out on the soccer field where there was no possibility that I was ever going to achieve any kind of a high level of play, right, and just enjoy it.
You kind of compete for yourself and have that enjoyment, but you're not like striving for, oh, I have to be a major league soccer player or professional. And that's where it's okay to have that. And as we get older, we kind of know where we are. Like we're good in our profession. You can have things that you're passionate about and hard driven for. There's certain things that we won't be elevated the best in. And many people, like sports as an example, most people are never going to make it to the top level, but they can still go out and have fun and enjoy it and play to the highest level they want and get as much out of it.
Yeah, but there are some of my patients who, whatever the area of their life, they can't turn off the drive. They may be a professional or they may be working in an office somewhere and they're focusing a tremendous amount of energy on being really good in that environment. But then when it comes to other areas of their life, they're doing the same thing. They're focusing huge amounts of energy on taking care of this person and the workplace and the neighborhood association or social organization or relatives or neighbors, and it just never stops for them. One of my patients, I met her early in the morning in the emergency room. She'd had an attack of abdominal pain. She'd been there all night. All the tests were normal. And it turned out that she had been a champion athlete as a girl. She won a national title as an 18-year-old. But she had done her sport before school, after school, and on weekends from the age of 4 onwards. It just never stopped. She never got to really be a kid. She never got a chance to just play. Now she's in her early 30s. She's got 2 kids. She works full time. Her husband works full time. She's coaching her kids in her sport. She's coaching other people's kids in the sport. She's driving kids to out-of-state competitions. She's on the athletic club board of directors. It never stops. And her body just finally put up the white flag and surrendered and started giving her this very intense abdominal pain. Her treatment was to take a block of time every week on a regular basis to get out of the house and do something, trial and error, various things, to find something that would work for her as something that her daughters were doing, just having fun. no goal about it. And she'd never done this before. She looked at me and she said, "What am I going to do?" Because she didn't know. But she started taking long walks in a park because she couldn't think of anything else. And for 6 weeks, excuse me, for 6 weeks, that's all she did. But while she was walking, she was thinking. And eventually, and her pain still hadn't gone away completely, even while she was doing this. She hit on the idea of taking piano lessons, which was kind of a surprise because she'd never done anything musical before. But it turned out she absolutely loved it. And that's when her pain finally went away.
Fascinating. Now, for people listening, they might say, well, how did their pain go away? Because there's no medication, there's no treatment. What is the impetus to make that go away? Kicking it back to the professional, walk us through kind of what the brain does and the body does when something like that will happen. People really understand how taking a walk and finding a fun activity and a passion can help ease pain.
Yeah, you were talking before about neurotransmitters, but it actually turns out to be nerve pathways. We have MRI studies of the brain in people with these conditions, and the way the signals are coming from the body are processed is different than it is in people who don't have these symptoms. And why have these nerve pathways changed? Well, it's because of stress, trauma, emotions, the long-term impact of adversity when you were a child, other challenges in life that seem to be able to change the way that the brain processes body signals and changes the way the brain is sending signals down to the body. And when we learn what these issues are and we can address them successfully, the brain goes back. We know goes back to a healthy pattern. We know from the Boulder back pain study, which is not just me and my stories about patients. We have actual gold standard research on this now. And the Boulder back pain study is a great example. They took 150 people with back pain for an average of 10 years, divided them into 3 groups, two control groups, and 1 group that got this new form of treatment that we've been talking about, which we can label as neuroplastic recovery therapy. And all they got was 4 weeks of 2 sessions a week, and their pain scores dropped by 75%, just from talk therapy. No opioids, no surgery, no injections. In fact, there was an injection group, and they got maybe a 10% improvement in their pain. Where this comes back to what's happening in the brain and why people are actually healing, they scanned these people before and after their treatment, and their brains physically changed in response to the neuroplastic recovery therapy. There really is a physical cause for these symptoms. They are not imaginary. They are not in your head. They are in your brain.
And that's what people really need to hear and understand is you're essentially remapping your brain through treatment. And it's hard because people are expecting, oh, I need medication, I need an injection, I need something arbitrary that's going to change this. But half the time, or I don't know, maybe majority of the time, it doesn't need to, but it needs to be worked out from the neuro side of it, because then you're right, it's all pathways, and everyone's pathways might be a little bit different. And that's where certain areas might light up with more pain than others in certain individuals. And when I look at certain individuals that are clients of mine, and I see their pain trajectory, and okay, why is it going here? Why is it going there? I very much come back to that autonomic nervous system. When the sympathetic nervous system gets too much and we're getting too much like vagus stimulation, the body's going to tighten up, and it's going to send pathways down to maybe where you were injured in the past, to maybe where you had trauma in the past. And then your body's going to use certain things as a protective mechanism to kind of send or try to divert the signal away. Would that be something that is on a similar track?
Yeah, absolutely.
Okay.
If you have an injury in the past, it doesn't always work this way, but if you have an injury in the past, then you've got a well-established nerve pathway going to that area of your body, and your brain may decide it's going to use that well-established nerve pathway when it's having stress-related pain. But again, these symptoms are 100% real. They are just as real as any other form of illness. I've had patients in the hospital with this, patients who've suffered these symptoms for decades. My personal record patient suffered neuroplastic symptoms for 79 years. And by the way, this is a good time to bring in why we chose that name, neuroplastic. Neuro means brain and nervous system. Plastic is medical jargon for a capacity to change. As in the Boulder back pain study, the brain's physically changed. It's actually a very hopeful term that people who have suffered from this for a long time can get better. Even that woman with 79 years of unexplained, undiagnosed pain was successfully treated in a matter of 3 or 4 months.
Wow. Because then when something like that goes long-term chronic pain syndromes, you kind of get people that are, the doctors are kind of in limbo with them because they don't know what they're doing. And they're trying to figure out, like, where's this pain coming? And there's a couple different like terms for that. But when I studied it a couple of years ago, heard someone have it, I'm like, wow, this is crazy. But there has to be something it's coming from. Like, yeah, it could just be random. But to me, a lot of stuff in the body, it's not random because the body's trying to tell you something.
Yes, that is important. This is a form of communication from the mind, these symptoms. And most healthcare professionals are trained, as I was, that if there's a pain or illness, there must be an injury or disease to explain it. But there's this whole other category of brain-generated symptoms that come from changes, physical changes in the brain. And if we can get the medical profession and the public and mental health professionals and coaches, trainers, physical therapists to be aware of this other possibility and to look for it, then all of a sudden we're going to be getting far better outcomes for people than we ever have before. Because there are tens of millions of people with this in the United States alone. It's 1 out of every 4 or 5 adults that suffers from this. It's 2 out of 5 of people that go to visit a doctor. We're talking about many people that almost everybody knows somebody who has this.
It's not as uncommon as people are going to think. It's more common than, I'm going to hate to say it, it's more common than your maybe your acute injury that you get just day to day.
Well, yeah, there was a study 2 years ago, to your point, looking at people with spine pain, either in the neck or the back. And they found, after very careful evaluation, that it was 88% of them had neuroplastic pain, and only 12% of them, 1 in 8, had from a structural cause in their spine. All of these injections and implantable devices and surgeries and nerve ablations that are done for people with back pain, they're all barking up the wrong tree 88% of the time.
Yeah. And people don't, they can't see us. I'm laughing because I work in orthopedics, but I see what you just said, because so many of the orthopedists, they can't understand that it is probably more of a neuroplastic thing. And they're like, well, we can do this. But then they get images and the patient or the client, they're perplexed because there's nothing on the imaging. They're feeling pain, but there's nothing, like you said, structurally there. Then it becomes what you do. It is a different conversation, whether certain doctors like to admit it or not. It's not more orthopedic. There might be nothing structurally wrong, but what is driving that pain? You got to look deeper. And that's going to be more of a case for most people than just your average, oh, hey, I come in and I've torn something, or it's a stress injury, but it becomes more of what is driving this from the neuro aspect. And I don't think that saying that means everyone had a past history or trauma. Saying that drives it. I mean, I'm sure it could just be like the stress of daily life, like that guy was stressful at his job, or certain stresses that are driving your system to say, hey, we're overloaded.
Yeah, it's the overload is a great one to comment on, because there was a patient of mine that I was asked to see. He was in his 70s. He'd had daily low back pain for over 25 years, and nobody could figure it out. The his particular spine did have some abnormalities. It turns out that if you do X-rays or MRIs on the spine of people who feel perfectly fine, people with no symptoms at all, you will find abnormalities in the spine in
Yes.
more than half of them over the age of 40, and
Yeah.
a pretty big fraction younger than 40. That gets to be really confusing, because you've got pain, you look at the x-ray, and there is something that you can point to. It's not very much. It's usually just part of the aging process, but it gets a huge amount of attention from the spine surgeon community. And a lot of people get operations on their spine for these abnormalities that are a normal part of aging. And as you might expect, the results are not very good. The success rate of spine surgery for pain is about 1 in 4 patients. The other 3 out of 4 either don't get better or they actually get worse. And the reason it's poor is, again, they're operating on the wrong thing. But it can be misleading when you see, this age-related problem in the spine, and you think it might be causing the pain because you can't think of anything else that would be
Uh-huh.
causing the pain. You're not thinking about brain to body conditions, and you end up injecting or operating or implanting a device. But my gentleman with the 25 plus years of daily low back pain, I was the first one to find out that it wasn't every single day. That 2 weeks out of the year, he was completely pain free. And you can probably guess what he was doing during those 2 weeks out of the year. He was on vacation. But he was not resting his back carefully on a warm beach. He was in British Columbia fly fishing. He's out there wading out into the stream in his waders. He's twisting around to cast the fly rod. And then he tells me at the end of the day, he helps the lodge owner clear brush from behind the lodge. Is
Wow.
he having any pain when he's doing this? Not a bit of it. When he gets back to his stressful home environment, pain always comes back. That is not structural back pain. And at 75, he had a few things on his spine x-ray that weren't quote unquote normal, but they were not responsible for his pain very clearly. We worked on what he needed was to get a little bit of that relaxation that he got while fly fishing, to bring that back to his home environment. That was going to be the key for him.
When you treat someone like that, an individual, what are your kind of methods? I'm sure everyone's a little bit different, but what are your methods to help someone kind of get into that relaxation mode when they're in that, I want to say, the environment, or the environment that did cause them stress or that pain? Like, how do you start to treat that? What's that look like?
Yeah, the simplest is just if we can link up the person's pain with something that's going on in their life right now, then we can try to fix whatever that stress is that's happening right now. Or if there's a person in your life that is toxic or stressful for you, we need to find a way to set some boundaries around that person. If you were treated badly as a kid, we need to start with the idea that you might have learned some concepts about yourself that are false. If you learn that it's your job to take care of everybody else in the world, if you learn that you're a second rate or worthless person, if you learn that you better keep your emotions buried and not let anybody, including yourself, experience them, if you learn that it's better for you not to assert yourself, even when you have every right to, these are all false concepts that people can absorb as basic assumptions when they're in a toxic early environment. And if I can help people to see where those came from and to unlearn them and replace them with something healthier, then their stress level goes way down and their physical symptoms follow behind that, get better.
And I'm sure that is something, it can be done, but it's easier said than done. It's a hard process to unlearn that false concept. And I'm sure it will take time, like just that Boulder study where you're just talking to someone. It's not that, what is it? We're not trying to ask for, hey, we're getting this medication, that medication. It's going to take time to understand, or your neurology of what happened, what's going on, and to kind of uncouple all that stuff and then rebuild it back up, which I'm sure with visits with you, and that's what you do and what you do daily at your job.
Yeah, it reminds me that one of the nice things that they did in the Boulder back pain study was actually very simple. They would reassure people that their medical evaluation had not found a structural cause for their back pain, which meant that they no longer needed to be afraid they were suffering serious physical damage, because they weren't. They no longer needed to be afraid that they were going to be permanently disabled, because their back was actually structurally sound. And that what they could then do once they had that, given that reassurance to themselves, was shift their attention from the source of the pain, where they were feeling the pain, shift their attention up to the brain and start thinking about, what message is my mind trying to send to me? What is it trying to tell me about my life, past or present, that it can only tell me through the medium of this physical pain? And once people started thinking about that, they started figuring things out. And that was transformational.
That's huge. And it is kind of like you have to look back inside yourself in your past to really elicit what might be going on. And that's one huge thing. Some of the medical industry that maybe they have certain occupation or specialties kind of forget to realize that our body is connected to this wonderful organ, the brain, and it is getting signals and sending signals all the time. Yeah, you might have pain in your forearm, but does that necessarily mean that the forearm is the one that's driving the pain? No. And it's like, you come see an orthopedic or a PT, they're going to focus on that area. It'd be great to have a little bit more of an open mindset to say, hey, there's pain here, but we have to respect that there's a brain connected to that pain. And if we treat the pain and it doesn't change, we need to now go to the boss, right? And you're always, for me, what concept is, when I ask someone to do an exercise or position or whatever, I'm knocking on their boss's door, which is their brain, which maybe even subconscious. I'm saying, hey, I want to do this. That brain might go, I don't want to do that. Or that's a hard ask for me because I'm not used to it.
Yeah, it's, most of us grow up with the idea that, yeah, the brain can do some things to our body. If we blush with embarrassment, that's a mind to body experience. If we feel a knot in our abdomen when we're in a tense situation, that's a mind to body experience. But we usually don't, even as medical professionals, have the idea that our minds can do anything more significant than that.
Yes.
And I had to learn that process. I had to be convinced. I definitely was not at all convinced when I started out. But one of my patients is a 17-year-old girl. She had been having unexplained abdominal pain for a year and a half. She'd already seen 6 other specialists. And when I was asked to see her, she was on hospital day number 70, getting massive doses of morphine around the clock to try to control her abdominal pain. This turned out to be 100% due to stress. 30 days after we met and I identified what the stress was and helped make some changes in the family, the stress would no longer be there. 30 days later, she was off of all opioids. She no longer had any pain. But it shows you the severe levels that this can produce. Another good example is phantom limb pain, where somebody's had an amputation and they feel pain in the place where their limb used to be. It's not there anymore. It can't be responsible for the pain, and yet it can be very severe. And that was something I had to learn, that the power of the brain to produce up to very severe levels of pain or illness.
That one is the craziest. I remember in the neurology book I read that kind of explained that even though, yeah, the limb's gone, that neuro pathway and circuit is still there. You can still perceive something that's not there because your brain has the structures and it can still fire an electrical signal to it. Like, that's crazy when you think about that. It's like what your brain is signaling all through electrical currents is fascinating.
Yeah, if you want to get into the neuroscience, it's one of the interesting things is that all pain is experienced in the brain. If you sprain your ankle or you whack your thumb with a hammer, you are not getting a pain signal from those places. You are getting a damage signal. And the damage signal goes up to your brain, and your brain has to decide, is it going to give you pain there or not? And usually, of course, it does, because it wants to protect the injured body part. It wants to let that you have to be careful of this part of your body so you don't injure it further. But there are times when the brain will decide it's better I not give you a pain signal. For example, you're running from a predator, you sprain your ankle, your brain is likely to decide no pain in that ankle right now until we get to safety. The pain is not going to serve you when the predator is still after you. Once you get to safety, then we can let you feel the pain.
It is always very interesting when we talk about that word pain. I always ask clients, okay, well, what do you feel? Because a lot of people sense pain differently, whether it's tightness, whether it's burning, whether it's sharp pain, pulling apart, stabbing. I always get these different descriptions of what pain is. And that kind of, for me, I try to let it help me guide what the body is trying to do. Now, this is in the realm of more, we're talking like exercise or position or sports, like coming back from a stress injury to understand the mechanics. But I'm sure that tells you a lot of, okay, this is how the brain is perceiving something and how the body is reacting to that damage signal, because it might be damaged to different degrees, and then certain muscles or certain bones or positions or patterns are coming up as the body's trying to either avoid the pain or manage and deal with it, but just can keep going because the body's not going to stop. Like, it needs to keep going, and people need to go to work and they need to do all their activities. So it's going to figure a way to keep going, or that pain signal just kind of keep ramping up, and people have to, unfortunately, have to figure out how to manage it.
Yeah, and sometimes the mind will give you such a strong signal, and it doesn't have to be pain. It can be fatigue or brain fog. And I've seen people with fatigue that was bad, that all they could do all day was crawl from their bed to the bathroom and back. Non-pain symptoms are possible as well. And the brain can create these in the body, even after an injury has healed, even in some cases when there was no injury in the first place. There was a famous picture in the British Medical Journal about 30 years ago of a construction worker who impaled his boot on a nail, and he was instantly in agonizing pain. I mean, the sharp end of the nail came up out of the top of his boot, and he was rushed to the emergency room. He was given morphine intravenously, and then the boot was carefully cut away, only to reveal that the nail had passed neatly between his toes. Did not have a scratch. But because of the information that was coming to his brain about looking down at his boot and seeing this nail, it created the sensation of pain in his foot.
And that just shows the power that the brain has. And rightfully, like, if you look down and saw a nail sticking out, you're going to think, okay, there's something seriously wrong. And that all needs to be taken in consideration when we're talking neuroplasticity and how the brain learns and how the brain deals with things, especially as human evolution, meaning like from the day we're born, different phases that we grow into to become an adult. It all plays a role of how our bodies are going to react. And the cool thing is, like, my world of postural restoration, it understands that if you're in certain positions, you're going to get certain signals because of your autonomics, because of your tension and tone throughout the system. Maybe it's not like chronic pain, and you hope it never is, but that's one way where you can help decrease the demand of tension through position. But really, when I start getting into the weeds, a lot of the stuff with clients, it all comes down, you're changing your cranial position and how the brain flow and afferent and efferent nerve conduction plays the big role in it. And that's where I love to have a conversation with, because that's what you're really changing day to day. And I'm sure that's what you're changing even by having conversations with people, is that sensory flow of information and understanding information of the past mixed with the future and present to understand who that person is.
Yeah, that is the main subject of a famous speech that was given not too far from you at Harvard 100 years ago, where Professor Peabody said exactly that you have to know who the person is to fully understand their condition. And particularly with posture work, if you add some of these ideas to the work that you're already doing, you'll find that there's a very powerful interaction going on there with people's stress from their present life, stresses they may have experienced as kids, personality traits, triggers that might be going on, a lack of taking time to put themselves on the list of those they care for. All of those things can interact with a person's posture and with how they're feeling in their muscles and tendons and ligaments. And if you combine those together, the outcomes that you get with your clients, at least my experience, are much better.
Oh, absolutely. The body is just kind of giving you an insight of what the brain wants to do and is trying to do. And when you couple them together, that's when you get the best results. And that's when best results, I always think people get to understand how something is working and understand themselves to then further help treat themselves. Because at the end of the day, like, yes, you're helping them get treated, but you're helping them treat themselves, which is a powerful tool.
Yeah, absolutely. Yeah, it would be very interesting for your clients to take that 12-question self-assessment quiz that we have on symptomatic.me and see what kind of answers they get. If they get a lot of yes answers, then absolutely combining the neuroplastic work with the work that you're doing, you'd see even better outcomes than you are already.
Well, definitely have them get into that and start kind of learning more about the neuroplastic things. I'll dive into, I know you got a lot of links. I'll have to dive into that in the podcast to enhance my own education on that side of things. Because that's really where I like to start to study is not, I love exercise, I love nutrition, but the neurology really has me fascinated. And that's the kind of books I start to read nowadays is how can we fine tune the brain and give it what it wants from a neurotransmitter standpoint and help people understand and navigate society, because nowadays it is becoming crazier with social media and these platforms of quick dopamine. And I see it in a lot of my younger athletes. They have a hard time dealing with the fast pace of society and understanding that some of this stuff is just quick dopamine fixes, but they don't understand that. They're just saying, oh, this is fun, this is cool. Well, how do we navigate them through growing up with this?
Yeah, they've got many challenges now. The younger generation, kids who are still in school, for example, if there's a rumor that might have taken days or weeks to circulate back in my day, it can circulate through an entire school in a lunch hour. And that's just really tough to deal with. I should mention also, I'm not the best self-promoter, but my first book, They Can't Find Anything Wrong, has got about 4 dozen stories about the different kinds of stresses that can make people physically ill. And it's the way I wrote it was the last thing from a neurology textbook. I tried to stay away from the dense medical detail and just tell stories that would relate to the people who were reading it.
And can people find that? Can we find that on Amazon?
Yes,
Pick up a copy?
that's pretty much where it is nowadays. Yeah. What I like to mention is that there's tremendous hope for this. I have seen many people who were ill for years or decades who felt hopeless, who had been trying everything, and there's so much out there that is being sold to people with these conditions: supplements, pharmaceuticals, manual treatments, devices, injections, invasive treatments, surgeries. And if you have a neuroplastic condition, a brain to body condition, those forms of treatment are all aimed at the body, which is not where the problem is. And consequently, people get highly frustrated and so do their doctors that things aren't working, that who was trained that it's your body, it's your structures, it's your organs, and all of their training is not helping the patient. They're getting frustrated. The patients are getting frustrated. But this approach, I have seen it just transformational for people and for physicians. The physicians who learn how to do this, suddenly the 40% of their patients that have brain to body conditions go from being highly frustrating highly rewarding because of the good outcomes that are achieved. Tremendous hope for people who might be on the verge of giving up. Keep going and try this approach, and the likelihood is you're going to find significant improvement.
And where can people find you online, or where can people go if they want to work with you?
I'm only a teaching doctor these days, but there, on symptomatic.me, there is a whole directory of healthcare professionals who have taken extra training in this field who are excellent. And many of them will see patients via telehealth or Zoom or whatever video connection it is from sometimes around the world.
Awesome. Well, we appreciate you coming on.
Matt Gluckman and Eric Menchie here from Think Fitness Life. Our entire careers have been dedicated to fitness, particularly how the mind helps the body. We've been around gyms and nutrition strategies for 25 plus years collectively, and nothing harms or helps better than your own mind, untrained or trained. Pushing beyond your limits, overcoming whatever's thrown your way, and making the decision to show up day in and day out as a lifestyle takes more soul than sand. And what I mean by that is when you can get your mindset and heart leading you consistently in the direction of your goals and dreams, well, it's just a matter of time before you have the performance, physique, or quality of life you're yearning for. See, your thoughts will stem from your beliefs, which will then lead you to action, which develop into your behavior and ultimately lead you to results. It's really that simple. Our process takes time and it takes open communication. It's amazing what pops up along the fitness journey to betterment, and we can be there every step of the way. To learn more or apply for coaching, visit www.thinkfitnesslife.com. Start recreating your life today.